Hello, I'm Jeff Michael. There are now more than 60 cases of measles that have been reported here in California, and just since the beginning of this year. More than 40 of those cases have been linked to people who visited Disneyland and California Adventure. That was last month, including several workers at the park. Now, why should you be concerned? Because measles is a highly contagious disease that can be transmitted up to 2 hours after an infected person leaves the room. Christina Gonzalez has more.
A percentage of those who had vaccine will get it.
The measles. Even some of those who've had the vaccine may get it anyway, according to Dr. James Cherry at UCLA, who adds that just last spring in California,
18% of the people with measles had 2 or more doses of vaccine.
That is especially true for those who had the vaccine many years ago, as the effectiveness can diminish. People who may be concerned about their protection, especially those who don't even know if they ever had a vaccine, they can't get vaccinated.
People who know they had only 1 dose should get a vaccine, sooner the better. People who don't know should get vaccine. And there's no risk particularly with that. If you had measles, documented measles, you're protected for life.
After recent evacuations at clinics and schools where children with measles symptoms showed up, the Centers for Disease Control is asking anyone showing initial symptoms like coughing or red, itchy eyes to consult with their doctor over the phone and not go to a clinic or emergency room.
And that's at the peak level, and you're contagious for about 4 days before you have the rash and at least 4 days afterwards.
How about everything you touch, from door handles to the elevator buttons? Can you get measles from touching something an infected person used, and if so, for how long?
I mean, the question always comes up, well, somebody was in this doctor's office 2 hours ago. In general, the measles is gone.
The last time the U.S. saw a resurgence of measles between 1989 and 91. Then a total of 123 people died. 90% of those fatal cases occurred among those who were not vaccinated. All right, here are some things you should know about measles. As we said, it's an airborne disease. It can be transmitted through coughing, sneezing. Symptoms include fever, cough, red eyes, sore throat, as well as a skin rash that we've all heard about that develops. 3 of 10 people who get measles also develop other complications. That would include pneumonia, ear infections, and some things even worse. And if you've gotten the measles vaccination or have not already had measles, there's a 9 out of 10 chance you will be infected if you're exposed to that disease. Now, there is some good news after all of that I've just told you. If you think you've been exposed and you have not been immunized, you might prevent the disease if you get vaccinated within 72 hours of being exposed. So to talk about more about where we stand right now with measles is Dr. James Cherry. You just saw him in Christina's story. Dr. Cherry is professor of pediatrics at the David Geffen School of Medicine at UCLA and Mattel Children's Hospital at UCLA. Also here, Dr. Lauren Crosby. She's been a guest with us many times in private practice at Lapeer Pediatrics. And Dr. Crosby, I'm just going to start with you because the camera's on you. You've seen a change at your practice because of this measles outbreak.
I have. Well, we've had a lot more phone calls. I even feel like people are more willing to just not even question at the 1-year visit. What shots do we need? MMR and whatever we give them. And they just say, do it, please, give it to us.
Before they were
we had a lot of problems convincing people to give an MMR. It was a big problem. Once Jenny McCarthy happened, once the Andrew Wakefield study that we may be talking about more came out, people were very reluctant to give an MMR vaccine to their child. They were afraid it was going to cause autism or other developmental problems or immune system problems.
And Dr. Cherry, that must have been frustrating for you. You were around, not to date you here, but you were around back when this vaccine was developed, right?
Yeah,
And you saw the eradication coming. Tell me about a brief history of where we got, how well we did before what Dr. Crosby was just talking about happened.
Yeah, vaccine was first licensed in 1963, but wasn't put into universal use until 1966. And through the use, it literally went away. And then in 1971-72, back for a number of reasons, but mainly people improperly vaccinated and not vaccinated, and then went away again to 1976-77.
But as it rose and fell, the whole way we were still diminishing the number of cases, right?
Yeah, well, the peak in 76 was actually quite high, away until 89, when we had an incredible epidemic, including, I think, 70 deaths in California.
Yes, yes.
And the things that we did extensive studies in St. Louis in 71, 72, and we showed at that time to get herd immunity, you needed 2 doses. But that, when I made many trips to CDC, as did other people realizing it.
Yes.
But because of the bureaucracy or bureaucrats and people who were worried that if we concentrated on measles, we would wouldn't put money into rubella vaccine, for example.
Okay.
And so we really didn't get the 2-dose schedule until after the 1989-90 epidemic.
My point in taking us there is that we reached a point where we won. We thought we won or nearly won the battle. And then, as brought up, out came a movement, and we'll talk about it a little bit later, where people said, oh, this vaccine could cause autism. Do either of you, or both of you, blame that movement on this resurgence we're seeing now? Dr. Crosby, I'll start with you.
I would say yes.
You would say?
I definitely do, because I know that a large number of those at Disneyland were unvaccinated. A few of them were too young to have received the vaccine, but there were many who should have and could have.
Dr. Cherry.
This is, when you look at the percentage unvaccinated, we're well below the number we need for herd immunity. But there's 2 things here, in addition to those people, and these are people who aren't vaccinated because they have difficulty getting to the doctor and things like that, and they're allowed to go to school.
Right.
September, there's no measles around.
We have to go to a break, but very quickly, both of you would agree you don't have to spread out this vaccination into 2 doses.
Correct.
Just, 2 doses, but very close together.
But, I mean, normally we give it at age 1, we give it again at age 4.
All right.
Standard.
All right, but you could give it even sooner,
We
after
can.
the second dose.
You definitely can.
All right, more later in just a minute, but when we come back, they were exposed to measles at Disneyland. They headed back home, so how many others do you think could be exposed? Welcome back. Of course, people who were exposed to measles at Disneyland eventually visited other places, which led to even more people being exposed. Phil Schuman went to Long Beach, where one of the Disney cases...
This Stater Brothers Market, one of at least 4 locations in Long Beach visited by the person who's come down with measles. This warning sign up on the door, if you were at any of these businesses on the morning of January 3rd, aren't sure, watch for symptoms, fever, rash, cough, watery eyes, and call your doctor. Fortunately for shopper Nancy Huntington, she's immune because she's already had the measles and
my kids have, and they've been giving vaccinations. Probably should be worried.
Worried is a good way to describe health officials here, who fear even more secondary transmissions, as they're called. They've added a detailed section on measles on the city's health department.
Adults and young children can get ill enough to require hospitalization.
Dr. Mitchell Kushner, the city's health officer, says it's important for the medical community to be proactive.
It's spread by respiratory. It's within a small area. It is very, very infectious, and as it diffuses, much more so than influenza and other conditions. That's why we're concerned.
Immunity to most strains of the measles virus. You should have had it when you were a baby. If not, you can still get it. Jose Rodriguez is thinking about it. He comes in contact with a lot of people in his job.
I transport people, so I picked up from Disneyland would have it and give it to me maybe, and then I'd give it to other people. I felt like I'd be like a perfect person to like give that to other people too.
And let's pick up on his point, and that is exactly affected because he accidentally could come in contact with someone from Disneyland. Dr. Cherry, what's that likelihood?
Well, I need to know whether he was vaccinated with 2 doses.
Okay. But for someone who vaccinated way back in the 60s, might have worn off a little bit.
Yes, that's true, but they generally don't get as sick. They have mild disease.
Okay. Now, Dr. Crosby, I love questions, but you were really going at it earlier before we went on the air because you have a practice. What questions do you have for Dr. Cherry?
I think one of the questions we get a lot about is airplane travel now. I think people are 2 hours. You're on an airplane and you're confined. In general, let's say domestic travel, is there more of a concern right now leaving LAX and going to New York with your baby, let's say your 8-month-old?
With measles, in the first 4 days before the rash, there's a definite risk. But it is somewhat overblown because the tremendous fact is if there was a patient on there, there would be many secondary cases if people weren't vaccinated.
Okay. And if the Disneyland outbreak hadn't happened, I mean, do we feel the risk is higher because of that and they're leaving?
It's
Probably
a little
not.
too early to know that, but I would suspect it's a little bit greater, but it's not at the alarm state right now.
So you wouldn't say if your vaccine once the child is 6 months old, to go to domestic travel, you don't necessarily recommend they have to get the vaccine right now if they're crossing the country?
Well, I would, for you, I would evaluate each one individual case.
So just to jump in here, Dr. Crosby doesn't have to wait until the baby is 1 year old. You can do it at 6 months.
You can give it at 6 months, but then you still have to give 2 more.
But
so
you don't have to wait until age 4 then.
You can give it 6 weeks after the first one if you need to.
Do you recommend that, Dr. Cherry?
Yes.
So you don't have to wait until age 4. Get it done as soon as you can.
I think that's a really important thing. If nobody is doing it, and we also, I did some calculations, and we should have 2,400 cases right now in the 3rd generation. But public health people have done, you can vaccinate people within 3 days of exposure and have it work. You can give immune globulin, which is being done, and you can quarantine people. All of that's being...
Dr. Crosby, thank you guys both very, very much. We will talk more about the measles outbreak with our guests and look back at the controversial study that Dr. Crosby was mentioning that linked the measles vaccine to autism when we come back. By the late 1990s, cases of measles had fallen dramatically thanks to the measles vaccine, but then controversy arose. That controversy came in the form of research that was measles, mumps, and rubella vaccine, they call it MMR, to autism in children. But the author of the research, Andrew Wakefield, came under heavy criticism, including charges of financial conflicts of interest, and was stripped of his license to practice medicine. But you know what? The damage had already been done. Model and actress Jenny McCarthy came to the forefront in the anti-vaccination campaign, and as a result, the MMR vaccine. And so we come back to where blame lies, and it's not blame at Jenny McCarthy's feet so much as it is how rumors and innuendo about, is it misinformation?
Yes, absolutely.
Absolutely.
Yeah.
So has there never been, just putting parents to allay their fears right now, has there never been any autism?
Correct.
Yeah, I'm not sure how you said that, but there's absolutely no risk of autism. But there's a temporal association. Autism is first being noted.
Mm-hmm.
Oh, so it just happens to be simultaneous, and it isn't causal.
Mm-hmm. No.
All right, so what do you recommend to parents now who, let's say do they rush into their pediatrician now and get the second one, or do they wait until 4?
I mean, right now it's not the standard of care to give the second one early. I don't think all the pediatricians are going to change right now and just give it right away.
That's interesting. That tells me that doctors,
right?
that tells me that you're somewhat...
Protection, though, it gives probably, what, 92%?
95%.
95%.
One dose
Yeah.
is 95% protective.
All right, so Doctor, would you like to see the protocol changed? Would you like to see it moved up?
Doing now, but but not have 10% unimmunized in our population. If we do everything right, we were successful before.
Here, Santa Monica, I think the personal belief exemptions, 14% or more that don't have all their vaccines. So I think that's a big part of it, because then again you lose that herd immunity there.
14%?
High, yes. And so
are either of you in favor of doing away with this conscientious objection?
Mm-hmm. Yeah.
Should not have the right to say.
There are rare cases where a child may have a problem, an immune system disorder, medications that they're on.
That's a medical
rare,
reason.
And that is a medical reason.
Right.
So,
be changed, Dr. Cherry. How do you change that in public schools, allowing for conscientious objections?
Well, I mean, it's sort of a political data goes back many years that states that had school entry laws had much higher immunization rates than states that didn't. And so I think if there's no measles around, we allow kids to go to school.
There you go. Mm-hmm. It's kind of like letting your guard down when nothing's coming at you.
Right, and then this happens.
All right, Drs. Crosby and... Welcome back, everybody. We've talked about what to do as far as getting vaccinated, but what do you do if you find yourself...
I'll let him answer. I have never seen a case of measles.
Dr. Crosby,
practice.
You've never seen a case of measles?
Well,
that makes
it hasn't
sense.
been around
You're too
for
young.
me.
It's a typical primary case of measles. They need to be watched very carefully for complications, bacterial complications. Otitis children will need to be admitted to the hospital. Ones with pneumonia, will get antibiotics, but they can also be...
The measles, should you trace back the previous 5 days and tell somebody where you've been?
Yes, hopefully the people...
And finally, if you got the vaccination back in the 60s, you were one of the early ones to get it, should you get revaccinated?
It depends if you still have immunity. Blood tested to see if you still have immunity. So, and he
that's an easy
had
blood
a suggestion
test.
as well.
All right. Drs. Crosby, Dr. Cherry, thank you very much for joining us. We thank our guests for being here. Make sure you've been vaccinated. Have a good night.